Hi, welcome to Google Plus Hangout. I'm Eleni Tsigas, and I'm the Executive Director of the Preeclampsia Foundation. First, a big shout out and a big thank you to Pregnancy Magazine for hosting this Google Hangout today. We are going to be talking about preeclampsia today, what it is, what expectant mothers should know about it, be prepared, and probably we should start with how to pronounce it, since it's one of those words that we often don't hear. Preeclampsia is what we're going to be talking about. How dangerous is it really? How many people does it affect? And should you be worried about it? If you do get diagnosed with it, what does that mean? How will your doctor or midwife diagnose it? And if we have a second, we're going to talk a little bit about what the long-term prognosis might be for those women who get preeclampsia. So besides what we're going to share with you today, you can learn a lot more about preeclampsia on the Preeclampsia Foundation's website, which is www.preeclampsia.org. And of course, you can follow us on Facebook and Twitter. So we've got an amazing panel with us today. I'm so excited to get talking with these folks. They've all got a ton of great information. We're going to introduce each one of them. I'll actually ask each of them to introduce themselves, tell us a little bit about their background. And we'll start with Dr. Doug Woelkers.
Okay, yes, Eleni. So I am Dr. Woelkers. I'm working here at the University of California, San Diego, where I've been now for going on about 12 years. And my specialty is maternal fetal medicine or high-risk pregnancy. And my focus of clinical and research interest is preeclampsia. And this started for me back about 20 years ago, working in my fellowship at the University of Pittsburgh in Pennsylvania. And from the researchers who started a trajectory of investigation there, I've been pursuing different avenues, different fields to try to develop tests to predict and diagnose preeclampsia, and better means of predicting which moms will suffer adverse outcomes and which moms may have a relatively unaffected pregnancy. And we'll talk more, I'm sure, about the research and information that's becoming available for patients. But at the same time, we can also answer your individual questions about the disease.
Great, thank you, Doug. Dr. Linda Burke-Galloway is also with us here today. Linda, can you introduce yourself?
Sure. I'm Dr. Linda Burke-Galloway. I'm a board-certified OB/GYN physician. I have been in community medicine and public health for approximately 24 years. I am very passionate about preeclampsia because it has affected family members, friends. I'm in a sorority where two of my sorority sisters actually perished as a result of preeclampsia, and I'm very passionate about the misdiagnosis aspect of preeclampsia. I think that if patients were more informed, if physicians and possibly midwives were more proactive in terms of informing patients about the risk factors that they have in the warning signs, I think that we can do a lot more justice to the outcomes of pregnant women.
Absolutely. And a quick little plug, about a year ago we did a review of about 60 pregnancy books. And Linda's book, The Smart Mother's Guide to Better Pregnancy, came out in our top 10 list, actually in our top 3 list. So a quick little shout out to Linda for really being an awesome author of a great pregnancy book. Nicole O'Connell is also with us here today. Nicole, why don't you quickly introduce yourself, and then we'll get started with some great discussion.
Hi, my name's Nicole O'Connell. I am a preeclampsia survivor. I was diagnosed with my first son, and he was actually born at 31 weeks, so roughly 9 weeks premature. And I am also the Promise Walk for Preeclampsia coordinator in Orlando, Florida.
That's great. Thank you so much. Thanks, Nicole. Well, it's probably worth me mentioning before we get into this conversation that I'm not only the executive director of the Preeclampsia Foundation, but I myself am a 2-time survivor of preeclampsia. Unfortunately, my first pregnancy, my baby died in the 3rd trimester, and in my second pregnancy, my baby was born early and quite small, but is now, I'm happy to say, a thriving, healthy 13-year-old. So I think between Nicole and myself, we have quite a variety of experiences to share as we get into this discussion. Well, without further ado, let's actually get into something about preeclampsia. I have to say that here at the Foundation, we've done a considerable amount of research in this area. And as Linda mentioned, we know that fewer than half of pregnant women are actually informed about preeclampsia during the course of their prenatal care. So let's start with, Doug, maybe you can take this first question. What is preeclampsia, and what do women need to know about it?
All right, that's a good place to start. So as you mentioned, the word is preeclampsia, and it might be useful to know that eclampsia is essentially a seizure or an epileptic event in pregnancy, and preeclampsia is therefore the state or disease that comes before that. And you might be interested to know that eclampsia and seizures in pregnancy and childbirth have affected womankind going back centuries, even descriptions of seizures in pregnancy affecting populations in ancient Egypt or in Greece. And it really wasn't until about the late 1900s that we began to realize that preeclampsia was diagnosable before this very bad end event. And through the years, we've essentially discovered that preeclampsia is a two-part disease. It involves the placenta, which is the connection to the mom's womb, through which the nutrition and oxygen flows. That's where the early risk factors for preeclampsia arise. And then it essentially spreads from that placenta to the mother, causing her blood vessels to become ill or dysfunctional. And currently, our best understanding of preeclampsia is essentially as a maternal blood vessel disease that can still lead to seizures. It can lead to injury of the kidneys, causing leakage of protein in the urine. It can, of course, lead to high blood pressure, hypertension, and essentially every organ system in the mother may be at risk of injury: the liver, the lungs, the womb, of course, if the mother's blood vessels continue to become sicker without recognition and without intervention. We can talk.
Linda, if we could just jump over to you a second. You talked about in your introduction how passionate you are about women knowing the signs and symptoms. We at the Foundation, there's a variety of statistics out there about how many women are impacted by this, but it can be as many as 1 in 12 pregnancies. So given that, what signs and symptoms do you recommend women be aware of?
So one of the most important things that women need to be aware of is when you begin your prenatal care, what's your baseline blood pressure? Let's say if you start prenatal care in the first trimester, actually every prenatal visit that you attend, every time you see your physician or your midwife, before you leave, you should know what your blood pressure is, so that as you progress in the pregnancy, for instance, Nicole was only 24 weeks when her blood pressure probably started to go up. Blood pressure is certainly one thing you need to know about. Any physical changes, especially as you move towards the beginning of your third trimester, if your feet start to swell, if your rings no longer are able to fit on your fingers, if your face is swollen, headaches, if there is a headache that you have that won't go away with the generic of Tylenol, all of those things need attention. They are things that you definitely should not ignore. If for some reason you get on the scale and you weigh 5 pounds more this week than last week, that's something that you should definitely not ignore, because all of these things are subtle signs of or could be potentially subtle signs of preeclampsia.
Nicole, did you have any of those symptoms?
I actually did. My blood pressure started to rise around 24 weeks, and I began to swell very slowly, but by the time I had gotten to 31 weeks, I had gained 8 pounds of fluid in a period of 4 days, and my rings didn't fit, and I could not even get a shoe on my foot.
But isn't swelling something that a lot of pregnant women have that doesn't necessarily indicate preeclampsia? Doug, do you want to address that?
Yes, and preeclampsia is a great imitator of many other diseases and even of normal findings in pregnancy. As you mentioned, the edema and weight gain. Some of the other symptoms that preeclampsia is known for are headaches, and many patients have headaches, so they may have had them before pregnancy or develop benign headaches in pregnancy. So it's difficult to decide which of these presenting symptoms is really preeclampsia and which may be a benign finding or another condition. So obstetricians focus quite a bit of their attention and clinical care on trying to differentiate the signs and symptoms of real preeclampsia from other findings. And hence, that usually means a lot of extra office visits, hospital visits, laboratory testing. Up to a third of patients in pregnancy at one point or another will have some finding that might lead their doctor to think they have preeclampsia.
And Eleni, if I could just jump in for a minute. So even if you present to your physician or your midwife and you have a headache and it appears that your blood pressure is a little high, but it's not an alarming number, a patient still needs to be followed up within a short time period. And I think one of the mistakes that people make is that we look for the classic triad, the swollen feet, the proteinuria, the elevated blood pressure. And so if all of these symptoms don't come in a package, then people discount them. For instance, if the blood pressure is up 20% more than it was last week, but there's no protein, people tend to poo-poo that, and that's where I think we run into problems in terms of misdiagnosing patients, so that even if someone, as a patient, even if someone tells you you're okay, you still need to be vigilant, because these subtle issues that you have will eventually build and build until, unfortunately, patients crash, and then everybody is running around like the chicken with their head cut off trying to fix the problem. Whereas if we had paid more attention, and we meaning your clinical care team, and you really need, as a patient, you really need to start inserting yourself as a major player. You are the main event, and everyone else should be supporting you. So I love the fact that in the past 3 to 5 years there's been more proaction in terms of patients, as it should be. So I don't know if I answered your question or not, but.
No, that's great. I mean, at the foundation we talk a lot about know the symptoms and trust yourself.
Absolutely.
But the trusting yourself is, I think, sometimes underrated, because we really do have almost like a sixth sense as women about our bodies, and I think sometimes we ignore those signals. And somebody said recently that in any healthcare situation, the one constant in any configuration of healthcare providers is the patient. She's always going to be at the center of that experience, and she really needs to be a partner with her provider to bring what she knows about her body and what's normal and what feels wrong. I don't know, Nicole, if you had this experience, but after the fact, did you have this sense of like, dang, I just knew something was wrong?
Yes, actually, I had that sense from about 20 weeks that I felt like something was wrong, and luckily I had a doctor that took it very seriously and monitored me very closely and took everything that I said into account in making his diagnosis. But
Right.
yes, I definitely felt that.
So let's talk a little bit, if women are watching this and are pregnant, does everybody need to be sort of vigilant about some of these symptoms? Who gets preeclampsia? Doug, do you want to jump in on that?
Yeah, certainly. So your first remark is correct, that essentially every pregnant woman needs to know about this and be aware of it, but there are risk factors that a doctor and a patient can identify to warrant higher levels of attention. First of all, a first pregnancy. So having a first pregnancy is actually a risk factor. It increases the chance of preeclampsia over subsequent pregnancies. So that's a lot of you moms, and that's something to take to heart. Certainly the strongest risk factors for preeclampsia would be a history of chronic high blood pressure or chronic renal disease, a history of preeclampsia in a prior pregnancy, especially if it was severe and early onset. And other diseases and conditions that promote heart disease are risk factors for preeclampsia. That includes being overweight, having poor lipid balance or polycystic ovarian syndrome, and even having a family history of preeclampsia or early heart disease is a risk factor. And there are additional things that doctors can pick up in any particular pregnancy, following the baby's growth, following rapid weight gain, as Nicole and Linda mentioned. But the main risk factors we've just gone over there.
And what would be, and I guess the thing that I would want to underscore, being a survivor myself, is, you know, after learning about this, after I got it, I went back over that list of risk factors and seemingly did not have any of them, except for the fact that it was my first pregnancy. Mm-hmm. So I think the thing that we caution women is certainly pay more attention if you meet any of those items on the risk factor list, but don't discount yourself if you think you don't hit any of them. Because certainly we don't know how our bodies are going to respond to pregnancy until we're pregnant.
I also just want to jump in for a minute and mention older moms, because with the whole IVF movement, women are postponing their careers, they're having children late in life, and a woman who is pregnant for the first time and is 35 or older should definitely pay attention to what's going on with her pregnancy, as I'm sure she would. But clearly, the extremes of the reproductive age group, the very young and the very, quote, old, definitely are risk factors that need to be taken into consideration.
That's right. Let's talk a second about the baby. What kind of impact does this have on the unborn baby?
Small babies, well, I don't want to mention people's history, but if you have to be delivered early because of preeclampsia, then more than likely your baby's going to be premature, the baby's going to be in the NICU for a while. Most babies do okay, but occasionally there might be some issues, and I don't know, Doug, if you want to add anything to that or not.
Yeah, certainly, Linda. It turns out that preeclampsia is the #1 cause for early intervention, early delivery of babies in the country. #1 cause, and that's often affects infants in terms of their prematurity. If they're born that early, they'll have those battles to fight. Fortunately, by itself, preeclampsia doesn't lead specifically to an insult or a disease process in the newborn. It's really relates to the prematurity. In the womb, however, the placenta that's not functioning well does may underfeed the infant with less nutrition or oxygen, leading to growth restriction, and that can compound any newborn difficulties related to prematurity. At term, for many women at term, about 90% of cases of preeclampsia are going to occur after 34 weeks, and in that case, the outcomes are a bit better. It's those severe early cases, like Nicole's development of preeclampsia so early, that worries us the most.
Mm-hmm. Yeah, and with my pregnancies, I mean, my first one, I was 29 weeks pregnant, and that's in the 3rd trimester, and had what was essentially an undetected placental abruption. That's where the placenta pulls away from the uterine wall, and not a good scene for the baby. And you know, she was growing okay, but that placental abruption really is ultimately what took her life. And with my second pregnancy, where I also had severe preeclampsia, you know, I sort of joke because the contrast between the second pregnancy and the third pregnancy is that my second one, my son's umbilical cord looked like a dry, shriveled up straw. I mean, it was just pathetic how that he got any nutrition out of that whatsoever. But babies, the physiology of how pregnancy works is amazing, because clearly there's this fighting instinct, and all nutrition that they do get is shunted to their heads and to their hearts, the most important organs. And so I joke because my baby came out quite small. He was about 4.5 pounds at 35 weeks. This is now my second. But he had this huge head, and like I said, today he's just like the most brilliant member of our family. But babies are pretty resilient, but the prematurity issue is significant, and that's one of the reasons we really need to pay attention to preeclampsia and try to do the best thing possible for the babies and the mothers. Mm-hmm. Nicole, you went on to have another child, didn't you?
I did. I had my second son 18 months later, and I did not have preeclampsia with my second pregnancy.
And how many people of all the pregnancies, Doug? I've heard statistics anywhere from 3% up to 10% of women who will have preeclampsia or some hypertensive disorder of pregnancy.
You're right on, Eleni. So we in the United States, about 4% of women are diagnosed with the complete preeclampsia syndrome. That includes new hypertension and new proteinuria. But about 10 to 12% of all women have hypertensive disorders. That can include chronic hypertension, or even a delivery just with hypertension and without the proteinuria. But with a prevalence of 10%, that means about 1 in 10 pregnancies will be affected by hypertension. So it's not uncommon. Moms definitely have to know that this is a spectrum of disorders that they may be diagnosed with.
So I'm sure a burning question in everybody's mind is, okay, so what do I do to prevent this? This doesn't sound good. This doesn't sound good for me or baby. What do I do to prevent it? Linda, do you want to take that?
Well, I don't think there's anything that you can do to prevent it, unfortunately, because we don't have a clear etiology of what actually causes it. We do know, as Doug mentioned, that there is some involvement with the placenta and with the maternal arteries, but I would recommend that patients eat properly. I recall a patient who developed preeclampsia at 25 weeks, and her favorite food was hot dogs. So certainly you don't want to eat a lot of processed foods or foods that are laden with salt, because that will just aggravate the high blood pressure.
That sounds like good advice for any pregnancy.
True.
Yeah, what we know is that the incidence of the development of preeclampsia tends to be reduced in populations that are healthy. And if we look outside the United States, in developing countries, the incidence of preeclampsia almost double the rate here in the United States, and it takes a much higher toll on babies and mothers. So good general health. And in America now, that often means watching weight gain and weight control. Diabetes and gestational diabetes are also known risk factors for preeclampsia. If I were to give advice about preventing preeclampsia, it would really focus on preconception, achieving the best health you can, and planning your pregnancy. And that can give an optimal outcome. Linda's right. We don't have a drug or an intervention that will prevent preeclampsia, but by having the best mother's health possible at the beginning of pregnancy, we get the lowest rates of preeclampsia.
Mm-hmm.
For those women who do get diagnosed, what can they expect? What will happen to them in that process?
Well,
go ahead, Doug.
I
defer to the maternal fetal medicine specialist.
I think Lynn knows very well, because as every obstetrician knows, and you don't have to have a perinatologist to diagnose preeclampsia, what the woman will expect is those blood pressures being repeated in the clinic, and if they remain high, probably being sent to the hospital, having the urine collected to evaluate for proteinuria, and having selected blood tests performed to see if there's any injury to the mother's organs. During this workup, it's important that the baby be evaluated. That often includes an ultrasound to assess fetal growth and fluid. It may include electronic fetal heart rate monitoring to look for the status of the baby as well. If the pregnancy is early and the disease is severe, then perhaps a consultation with a neonatologist to prepare for nursery issues. If prematurity is an issue, treating with antenatal steroids to help accelerate the baby's lung maturation. And finally, the one intervention that most patients remember is the use of intravenous magnesium. Do you remember that, Nicole?
Oh, yes, the magnesium. Hot flashes.
Hot flashes, yeah. It is a relatively benign drug, but it has a great benefit in preventing the occurrence of the eclamptic seizure. It reduces that risk by at least 2-fold up to a 5-fold reduction in really sick moms. So we give that magnesium to prevent the seizures. As many other things your doctor may prescribe as well.
Eleni, I just want to jump in for a minute on 2 quick points. The mag, there have been studies of late that have shown that magnesium is very helpful in terms of reducing neurological defects in babies. The second thing I want to talk about before we end is what happens after the birth of the baby, because women are still at risk for having eclamptic seizures, and that's something that we don't really focus a lot about. I've had patients who've gone home, discharged, and have come back 2 weeks later in the emergency room with a seizure disorder, having a seizure, and have been misdiagnosed as having new onset seizure, when in fact what they were experiencing was preeclampsia, well, an eclamptic seizure. So I think it's very important that patients realize that even though you get sent home after having the baby, you still have to be vigilant to make sure that you're not having any symptoms, especially if you get shortness of breath, you know, after having a baby and you go home for no reason. You're not exerting yourself and all of a sudden you're getting short of breath. You need to go back to the hospital.
Nicole, tell us a little bit about your sort of postpartum, right after delivery and even through today. Have you had any either long-term issues, or how long did it take for your preeclampsia to resolve?
Postpartum, I did have, my blood pressure didn't stabilize for about 6 months, even with medication, postpartum. And then I did continue on a blood pressure regimen up until actually 2 weeks ago. I was finally able to stop all blood pressure medications, and it's been about 4.5 years since the preeclampsia.
Wow. Well, let's talk a little bit about that. I know most women watching this are going to be actually pregnant and more consumed with getting through that pregnancy. But for women who have had preeclampsia, what is the prognosis for their long-term health? Doug, can you talk about that a little bit?
Yeah, essentially the concept is emerging that pregnancy is a stress test of the mother's blood vessels and heart system. And those women who develop preeclampsia are at higher risk later in life for hypertension, about a 3- to 4-fold increase, higher risk for a renal injury or end-stage renal disease, higher rates of stroke or other blood vessel disorders, and even the mother's long life mortality risks are higher for those who've had preeclampsia. And essentially, the internal medicine community and other physicians are recognizing this and learning to use the incidence of preeclampsia in a woman's pregnancy as a risk factor for extra surveillance as a woman goes through menopause and enters later life.
So certainly one of the things, I know I've talked to hundreds and hundreds of preeclampsia survivors, and there's 2 ways of taking that news. One is really feeling quite dejected that yet this is another unexpected, very negative health bit in our lives. But another way of looking at it is that we do have the benefit of having that early indicator, and that we, more than even the general population, really need to take care of our ongoing health. We need to be exercising and watching our diet. And I'm going to toss this to Nicole a second, because one of the great ways to exercise is to join a local Promise Walk for Preeclampsia and get out there and walk a 5K and do something every day or several times a week, because our ongoing health is more important for those of us who are at higher risk. Nicole, tell us a little bit about how you've turned your experience into something positive, because one of the things we haven't touched on is the emotional impact of having something like this happen to you in your pregnancy.
The emotional impact for me was not having having to go through the NICU experience and the long-term effects of the blood pressure. And what I've done, and it's actually helped me, is I began to work with the foundation to coordinate the Promise Walk for Preeclampsia, which in Orlando is taking place on June 22nd, and that's actually helped me connect with other survivors and other women who have been diagnosed with preeclampsia, and share our stories and get the word out there to pregnant women and women who are about to become pregnant that this is something that is very real and something that should be taken seriously, and something for them to look at and basically know the symptoms, because that's going to be what in the end will help you be diagnosed early and give you a better outcome.
So certainly the outlook is more positive if diagnosed early. You know, before we wrap up here, I'd like Doug and Linda to just kind of reflect back to us. I think one of the things we are conscious of is women today have so much information coming at them through their pregnancies, and there are untold number of streams, internet and books and magazines and everything where we can get so much information. And I think the tendency is potentially to be overwhelmed by the information and to feel like that we're going to be scared even getting through these pregnancies. And I wonder if you can couch everything we've talked about today and kind of put it in perspective. If you were talking to a new mom or a newly pregnant mom, how would you talk to her about this in a way that is balanced between not alarming her to death, but yet empowering her with the information she needs?
Well, I think, number one, pregnancy is for the most part, is a joyous occasion. But to be forewarned is to be forearmed. And if you have any concerns, you need to have an honest conversation with your healthcare provider. If you feel that your concerns are not being addressed, I strongly encourage women to get a second opinion, and a second opinion from a high-risk specialist, such as a maternal fetal medicine specialist, if at all possible. It's what you don't know that harms you as opposed to what you do know. Certainly you need to filter the information that you're receiving, and again, it's the relationship that you have with your midwife or your provider. Any concerns that you have, they should be able to address them so that you're both moving in the expected direction, which is a positive birth outcome.
That's great. Doug, anything to add for that? We need to close here shortly, but anything you'd like to add?
I'd say Linda expressed that perfectly well, and she also has a book to back it up. So probably finding a good resource and sticking with it, arming yourself with the knowledge from your book, and talking about it with your provider at each encounter is my advice.
Excellent. Well, and I would be remiss in not mentioning preeclampsia.org. It's the Preeclampsia Foundation's website that is chock full of information. We're regularly regarded as being a very sound source of information, so we encourage everyone to come there for more information. And if you can, in the next couple of months, get out and join a local Promise Walk for Preeclampsia. It's a great way to not only get some exercise, but support a very important cause. We are extremely thankful to Pregnancy Magazine for hosting today's Google Hangout. We look forward to working with them again in talking about other preeclampsia-related topics in the near future. And thank you, everyone, to watching. Have a great day.
Thanks.